Happy Friday, everyone. Hello, hello, hello. So glad to have you here with us today. We're just giving it a couple moments, as we normally do, to allow our guests to get settled into this virtual learning space so that we can learn with and from each other. I'm so excited that you all have decided to join us for this hour of time. We don't take it lightly. You could be doing a number of things on this Friday, but you're with us. And so we are committed to giving you a great virtual learning experience. I'm Dr. Nika, founder and principal lead consultant of NWC, and we are delighted to bring you this opportunity each week for you to deepen your knowledge and understanding of all things diversity, equity, and inclusion and belonging as we intersect conversations about DEIB with leadership in business. So today's show is going to be quite special. We're going to engage in some really important dialogue, and I'm so glad that you're here with us. If you would take a moment and go to the chat, let us know where you are joining the conversation from. It's always a treat for us to be able to see where people are joining the conversation from. We have folks that are not only just across the United States, but we even have many that join from outside of the country. And that makes us smile every single week when we see that. I also want you to know that here at NWC, we really do value disability inclusion. So we do have the closed caption function that is available for those who may need it. And I want to welcome those who are joining the conversation today, also from LinkedIn Live. We do believe that if you're part of this virtual experience through Zoom, that is optimized. But for those of you who are catching us on LinkedIn Live, that's totally fine. If you want to hang out there, that's great. But we will place the link for you to join us on Zoom if you desire to be a part of this live community. I also want to bring to your attention that we have the chat feature. You also can leverage the comments feature within LinkedIn Live if that's where you're joining us from. It's a way for us to get proximate to each other, to extend the conversations. And so if I say something or our guest co-host mentions something that really resonates with you, I want you to take to the chat or the comments and share your sentiments, share those affirmations. If there's a resource that comes to mind that you think this entire community would benefit from, then share it in the resource area and the comment and chat area as a resource for the rest of us. We believe that sharing is caring here, and I know that we all can learn from each other. And so once again, if you're just joining us, this is Intentional Conversations VodCast. I am Dr. Nika White. Welcome. We're so glad you're here. Let the conversations begin, indeed, and that is precisely what we're about to do. I want to make sure we maximize every moment of time that we have today during this program. And so if you're just joining us, I want to, again, just extend a welcome to each of you. We have been expecting you, as we do week after week. And this week is going to be no different in terms of bringing you some rich content. And we hope that you will also engage with us and share in contributing to this learning experience. So as I normally do, I want to just frame us our time together today by sharing some information that we at NWC deem to be really important for you. So we want to put these thoughts into your hearing. We know that October, while we're getting towards the end, it is ADHD Awareness Month. And so I want you all to be aware of that. There are people that dwell among us that could actually be diagnosed with ADHD and they don't know it. I shared a story last week where I just met with a girlfriend who in her adult years was just diagnosed with ADHD. And it was really important for her because now she at least has something that allows her to know what kind of care that she needs as she's kind of navigating her life and her world. And so if you have someone in your life, a loved one, a coworker that has ADHD, be patient, be kind, get to know a little bit more about their situation, right? And support them as best as you can. Now, if you've been following us for quite some time, you know that we produce a lot of content. This is our way of showing up to the greater community with opportunities for people to deepen their understanding and knowledge so that they can begin to put into practice all of these constructs of inclusion, belonging, equity in any spaces where they may dwell. One of those resources is through our LinkedIn newsletter called Inclusion Insider. So if you're not connected or you haven't subscribed, I encourage you to do so. And this is just a way to stay closely connected to some of the content that we deem is important for those of us who are championing this body of work. I also have a LinkedIn Learning course that was released earlier this year at the end of June, and we have reached over 11,000 learners. The course is all about individual accountability for equity and inclusion. And I do have 2 new courses that are going to be released in Q1 of 2024 that I'm recording next month. And so many of you have supported my LinkedIn courses, and I'm so appreciative of that. And so spread the word, let others know. Now, as we think about what's to come in future weeks, as we kick off November next Friday, I want you to know some of the great co-hosts that we have lined up to share with this community. Mary B. Rice Booth is joining us on November 3rd. And in that Intentional Conversations VodCast, we're going to be talking about the work of DEI leaders in the K-12 education space, the challenges they're facing right now. And we know a lot of those challenges are a result of some decisions that have been made where many institutions and organizations and libraries are pulling back content that many of us feel like should be available to all of our students. And so that's something they're navigating, and it's a real challenge for them. We'll also discuss how DEI officers across different sectors can support each other. We're in this together. We need each other. We need everyone to be very intentional about protecting the full turf of this work. And so I look forward to that conversation to come on November 3rd, and I hope that you all will join us. And then following November 3rd, we have Christine Scott that's going to be joining. And Christine is another business owner. And I love the fact that as a Black woman, she is someone that really believes in being bilingual, and she's very fluent in Spanish. And so she has a company that focuses on professional language services space. And I cannot wait for her to come and share more information about how do we intersect that and the way in which it certainly can have an impact on efforts of diversity, equity, and inclusion. And then Mino Bepaya is going to be joining us, and she has a new book that's out. I know that you all are going to be interested in hearing from her. We're going to be discussing power and money and time, and how collectively all 3 of them relate to designing equitable organizations. Also, what she refers to as the racial triangulation between Asian and Black people, and how we can avoid falling into the divide and conquer tactics. And so I'm really interested in hearing her perspective on that. I know this community is also going to gain a lot of value from being a part of that dialogue as well. So as you can see, we have some great guest co-hosts that are joining us the month of November. And if you happen to know of someone that you think will add great value to this community, then we want to hear from you. I invite you to actually email my colleague, Amora Carter, at amora@nicolite.com. Let us know who you're thinking of. We would love to be connected and to have a conversation with those individuals to put them into our consideration set. Many of our guests that show up, they show up because you know them and you have recommended them. And so we don't take it lightly when someone from our community says, hey, you need to have this person on your radar. We are booking for Q1 of 2024 right now. And again, you can alert amora@nicolite.com. Okay, now at this point into our conversation, it always does me great pleasure to be able to introduce our guest co-host. This is a way for us to get really proximate to our guest co-host for the week to understand a bit more about her experience. And so I'm going to read her bio. And I do this every week because I want people to know the credentials, the accolades, the experience in which our guest co-host is actually showing up to the conversation. So give me an opportunity to do that at this time. Dr. Marilyn Fraser is the Chief Executive Officer at the Arthur Ashe Institute for Urban Health. And when I reference it going forward, I may just say the Institute, but know that I'm referring to the Arthur Ashe Institute. She is a research associate professor in both the Department of Medicine and the School of Public Health, SUNY Downstate Health Sciences University, which is also the State University of New York, and the co-director of the Brooklyn Health Disparities Center. As a co-lead of an investigative research team supported by several NIH and CDC grants, Dr. Fraser helped develop behavioral health intervention models and training curricula for the Institute's award-winning Black Pearls and Different Phase of Health programs. The Institute's community outreach programs prepare hairstylists and barbers to educate their clients about various health topics, including breast, prostate, and colorectal cancer, cardiovascular disease, HIV and AIDS risk reduction. I love that. We're going to unpack that because how many of us have all of these great conversations right in the chair when we're getting our services at a barbershop or at a hairstylist. And so I love that connection point, and we're going to unpack that. She also served as the co-PI, principal investigator, in conducting the Institute's Access Project to increase access to health and social services for formerly incarcerated individuals in Brooklyn. Guyanese-born Dr. Fraser is a graduate of the Spartan Health Sciences University School of Medicine in St. Lucia, and she did her medical training in the West Indies, Mexico, and the United States. She has received numerous awards for her leadership in health, including most recently the CUNY, which stands for the City University of New York, School of Medicine's 2021 Strong Women in Medicine. She regularly presents her work at scientific meetings nationally and internationally, and is a co-author on several publications and a book chapter. Dr. Fraser's deep interest in addressing health disparities and improving health outcomes in communities of color also allows her to serve as an expert advisory board member with the NYC Diabetes Prevention Project. And so if you've been with us for quite some time, you know that what I ask you to do at this moment is to find those accolades, those emojis, those reactions, whatever it is, but find them, and let's help welcome our guest co-host for today. I'm going to bring her into the spotlight. And I am so grateful that you're here with us, Dr. Fraser. One of the things that we do here as tradition, before we release our guest co-host to greet the audience in their own way, is we do ask that they share something with this community that perhaps is something we wouldn't know by reading your bio, or even maybe from visiting your LinkedIn profile. And so this is a time for you to help create some deeper connections with this community, but we would love for you to share anything that feels comfortable and appropriate to you at this time. Welcome.
Oh, welcome. Thank you so much. It's wonderful being here. One of the things that I think that people might not know about me is that I like to play badminton. And
Nice.
and I like the game. I've not played it a lot, and I had the opportunity to visit one of my friends in the Netherlands, and I said, yeah, I wanted to play badminton, and I got beaten really, really badly. And so I came back to New York and I started taking badminton lessons. And so I've been taking lessons. So, you know, for the next round, the next matchup.
I love that. Now, is that because of the competitive nature in you, or is it because maybe you also see badminton as something, as a stress reliever, as a way to, you know, get that exercise in, or maybe it's all of the above? I'm always curious as to what motivates someone to take something on as a hobby or pastime.
So yeah, I prefer not to say that it's a competitive nature. I prefer not to say that, but thanks for, you know, kind of cleaning it up for me. So I'll say the exercise and the pastime, it's really a grueling sport, actually, that I didn't know it was that much involved, but it is something that's really good in terms of exercise. But yeah, there's a competitive nature that, yeah. Want to match up, yeah.
There's nothing wrong with the competitive nature. For those of you who are familiar with Gallup Strength Finders, competition is in my top 5. And so I embrace it. I think that it makes me go harder sometimes, but nonetheless, thank you for sharing that. Okay, so I want to give you an opportunity to share a bit more about your journey and your story. So what led you to the work that you do now? Is there a backstory behind the connection points that allowed you to be pretty definitive in, this is the direction, this is my life's calling and purpose, and I know that this is what I want to do? Share that story with us.
Oh yeah, so even in medical school, going through my medical education, I really liked connecting with patients and explaining things and talking to them, because I felt as though oftentimes patients didn't get that space to talk about their issues. And even when you think about our healthcare system now, it's really fast-paced, and people go into a doctor's office and there's just a minimal amount of time to talk. And when I was finishing my medical degree, I did not know where I wanted to be in terms of a specialty. I thought people would always say, oh, you know what, you should be a psychiatrist, because psychiatry came easy to me to talk to people and really listen. But the actual practical portion of it was really hard for me. Emotionally, I thought that this is really tough. And I wasn't sure what I wanted to do. And my preceptor said, okay, there are options you have. You can go into doing research in in hypertension, or there's this other organization that's doing some work around breast cancer. And so I went to the hypertension work, and they didn't have any funding to actually hire someone to work with them. And I went to the breast cancer work, and that was at the Arthur Ashe Institute for Urban Health. And they decided that at that time they were developing a curriculum to train hairstylists to talk to their customers about breast cancer. And I went out into the community and connected with the community and did a lot of the education. Because I had a medical background, I could participate in the development of the curriculum. And I just went out into the community, and I really loved it. I really loved talking to people about health. And the other portion of the work that resonated with me was our Health Science Academy work. This is for students that are interested in the health professions. And I thought, oh my goodness, if I had that when I was growing up, it would have been something that would have been tremendous. And I got the opportunity to teach some of those students. So all of those pieces came together in a way that I would never have imagined. And 20 years later, I'm at the Institute. I started out as a coordinator, and then went to develop some of the programs for the Institute, the outreach programs. Went on to be the deputy director to our former CEO. And then when she resigned, I was placed in the position of CEO. So it's been a nice journey along the way, because I know a lot about the Institute from different aspects. And it resonates with me. All the different things that we're doing really resonate well with me, and I really enjoy it.
Yeah, and it's important to feel a sense of calling and enjoyment and fulfillment from the work that we do, especially when the work is really mission critical. And I would definitely say that helping people to be as healthy as they can is absolutely mission critical. And that's why I'm really interested for us to talk a little bit more about the Arthur Ashe Institute, because while we may have heard that name before, we know of the Institute, I'm not sure everyone is deeply familiar with how it came into existence and who Arthur Ashe is and why this is so important to communities that often are marginalized, like, Black, Indigenous, other people of color. And so I would love for you to talk about the goals and the mission of the Institute and why they are important to BIPOC communities.
Oh, yeah. So Arthur Ashe, the Institute was one of the last charities at Arthur Ashe. He was a tennis champion. In addition to being a tennis champion, being a humanitarian and activist, he founded the Arthur Ashe Institute for Urban Health just 2 months before he passed away. And when he founded the Institute, he wanted to create a place where we can address health inequities, recognizing that although he had his celebrity, there were certain things that his celebrity status, there were certain things that he couldn't get also, and healthcare was not always accessible to people. And so he wanted to create the Institute where we would conduct research, we would go out into the community and provide community education, prevention, that people can know more about their health and they could understand that. Also, he was interested in not only the health within our country, but the countries from which immigrants came and what the healthcare systems were like there. And so research was key to him, that we were doing community education, but also doing research, publishing on disseminating that research. And he was really interested in making sure that the healthcare workforce was diversified. So we do that through our Health Science Academy, which students of color that are interested in the health professions. We started out with high school students, and these are students from 9th through 12th grade. They come to the Institute, they learn about anatomy, physiology, they get to do different things, dissections and all of those kinds of things. And then we went back a little bit earlier on to the pipeline to the middle school students, so that they can to learn a little bit more about health. So the 6th graders get a general health message. The 7th graders get sports medicine, 8th graders get forensic sciences. And so we're trying to create a pipeline so that our students could go through high school, go to college and be better prepared. And one of the reasons for the Health Science Academy is that a lot of students of color are bright and they do well in high school, and when they go and they want to go into the sciences, and when they go to college, they're weeded out in the first year.
Yeah.
And it's not
Yeah.
that they're not bright or they cannot do it. A lot of social issues happen. You know, we face all these different things that we don't think about, discrimination that students face and they're not prepared, financial hardship that makes students worry about even paying for school and paying for college. And we know a lot of those students, once they go through that pipeline, they come back into the communities from which they came and they serve in those communities. So Arthur Ashe was really keen on those things, community engagement. He was also the health sciences, making sure that students of color were in the health professions, as well as partnerships, partnering with key organizations. So we partner with a consortium of over 70 community-based organizations. We partner with our barbers or stylists, faith-based institutions, and those partnerships are strategic so that we can provide education, but also link people to services. Because when we think about services, we think about those social services that impact our health, whether people have housing, whether people have food access to care, whether they're insured, all of those different things, whether they have transportation, childcare, all of these different things that impact our health and the stress that we face. And then finally, one of the key aspects of our work is policy, because we can do all this work if we don't change the systems that create these inequities, then things just stay the same. So working with legislators and working with community boards and others to make sure that policy is impacted. So those were the things that Arthur had in vision, and those are the things that we are doing, and those are things that are important as we think about making our communities more healthy and also impacting the health so that we can have better health outcomes.
Yeah, there's so much that you said, Dr. Marilyn, as you were sharing about the Institute. And I just want to kind of amplify some of those points, because what stood out to me is the holistic approach in which the Institute thinks about driving towards impact, right? Because I talk a lot about impact over activity. There's a key difference. And what I'm hearing as you describe all these different initiatives and programs is impact. We're getting to the root causes. We're peeling back all the layers and really identifying where there are opportunities for us to drive towards impact so that we can sustain this work. And one of the things that I heard is the social determinants of health. And you mentioned several examples, and I think that is critical. Sometimes we don't realize how other circumstances can also impact one's access to health, quality health. I also love the collective collaboration. You talked about the faith-based community and talked about professionals that are in kind of, the hairstyling and the barber kind of seats. And I think that's important. And we're going to unpack that a little bit further because I want to understand exactly how you all came to realize that this is a great place and space to talk about these things in a very intentional way. And then, Dr. Fraser, you also mentioned the importance of your story was, I wanted people to see someone that looks like them, that's doing this work, that's educated in this space, and so that they also can believe that this can be part of their trajectory. So I think that's great. And I love the fact that the Institute has a pipeline that does not just look at those who are entering into college, because sometimes that is too late. People have already, in many regards, made a decision about what career path they want to pursue. But we're talking about introducing this in high school, and you even mentioned middle school. And I think that is so critical. And so I'm just grateful for all the different ways that the Institute is really leaning into creating that impact and doing it in a way where it can be sustained. So I would love for you to give us a little bit more in-depth information about the inception of the program, like the barbershop talk with the brothers, and then there's also a Heart of a Woman. So talk about those programs.
Yeah, so as you said, those spaces are so important, right? Meeting the communities where they are, meeting people where they are in terms of going out into community settings, barbershops and salons. We visit those places and we talk about everything.
Yes.
Barbers and stylists, they talk about everything. And the stylists and barbers are oftentimes the counselors that we have in our communities. They listen to us, they know us, and some people have such a long history with their barbers and their stylists. So we thought about how do we integrate health messages within those contexts, right? Or barbers or stylists, they're talking about health in a certain way, right? Because they really want whether it's your hair, they know that whether it's doing well, that you're eating right, and it's like, okay, your hair is falling out. What are you doing? You need to do something else. What they are there, and they're so close to you in terms of like a conversation, and so we decided to ask them, like, how do we weave healthcare into those messages that you are giving naturally? So we would go into the barbershops, and this is before my time, or my predecessors, they would go into the barbershops and they would do a general health session. They'll have a clinician come in, and they'll talk about heart disease or HIV or any or whatever health issue. And the barbers and stylists said, after you guys leave, the conversations get more involved, and we want to be able to steer those conversations. We want to be able to be the ones that can guide the conversations and provide the information. So we decided to develop curriculum for barbers and stylists so that they can deliver these health messages. And the curriculum was culturally tailored. We asked them what we should use, what things we should, the colors, all these kinds of things, on how we should present the message. And our first curriculum was one that was on breast health. And even when we were doing that curriculum for the stylists, at first we were talking about preventing breast cancer. And that was the brochure that we showed them. And they said, our customers are going to shy away from it because people feel negative when they think about the word cancer. And so we changed preventing breast cancer to promoting breast health. And this is because the community, they're the ones that tell you what they need, and it's just spending the time and listening to them. So that's how we started that program. And it was our female, the ones for our salons, and then the one for our barbers. And we did a barbershop-based program that was focused on HIV, and it was Barbershop Talk with Brothers. Now we use that for all of our barbershop programs. And we do, in addition to HIV and AIDS, we talk about heart health, we talk about prostate cancer, and we talk about a whole host of things within the context of a barbershop. And likewise for the salons, we do cardiovascular disease. Our Heart of a Woman project. It started out with cardiovascular disease, but we have incorporated all the different diseases in there. Right now, we are focusing on mental health, especially post-COVID. And we are focusing a lot on that. So that's how we started, with hearing from our barbers and stylists, and knowing that it's a nice setting for people to talk and discuss things that are in a way that's non-threatening. It's a lot of stylists and barbers say that they're the counselors within the community, and people trust their stylists and barbers probably more than they trust going to their medical doctor and asking questions of their medical doctor.
Yeah, I love the creativity and innovation of just driving towards impactful solutions, of generating awareness and education. And I'm so glad that members of those communities, the barbers and then the hairstylists, were willing to actually leverage those relationships to be able to help be a conduit of this type of information. I'm big on language. I think language matters. And so the fact that the group was also able to influence how in which you are instructing and encouraging these barbers and hairstylists to talk about it. You mentioned that it's about promoting breast health. And I think that's fabulous. Yes, I think it's so wonderful. And what I also believe is that, these individuals are not clinicians. They're not in the space of understanding all of the scientific, ins and outs to be completely accurate in how in which they talk about it. But the fact that you all at the Institute are providing the tools and the resources for them to at least speak intelligently as they are providing a level of awareness to their clients, I think is great. And so tools are really important. You also have a program called Access, and it's the Access Project. And so I would love for you to share with this community about the Access Project and how it has been really pivotal, Dr. Marilyn, in increasing access to health and social services for formerly incarcerated individuals in the Brooklyn area.
Oh, yeah. So years ago, when we started the Access Project, we wanted to pay attention to people that were returning into our communities. There was a report that called certain areas $1 million blocks. And the $1 million blocks were not blocks that were wealthy, that people were having the wealth there. It was like, that's the amount of money that's spent to incarcerate, right?
Oh,
People
yeah.
in communities of color. And so when we think about those areas that are disproportionately affected with health issues and areas that are affected by poverty and so on, and yet they're termed $1 million blocks because that's the amount that's spent to build prisons, that's the amount that's spent to incarcerate our young men and women. And so we went into those communities and we developed a project that would increase and improve access to care, health care, but also access to social services for people that are formerly incarcerated. Interestingly enough, when we did a focus group with our barbers, I would say 7 out of our 8 barbers in average had a history of incarceration, were formerly incarcerated. And barbering was one of the few professions that people can get, that they can, a few licenses that they can get with a history of incarceration. So it was important for us to talk to our barbers about health, because a lot of people, when they return to the communities, come back to the barbershops, they come back to those areas that they're familiar with. And we wanted to make sure that people returning into community had health information, also information to services, whether it's employment services, again, insurance and different things that they can be linked to various communities. So when we went into these barbershops and also did some work in the salons under the Access Project, we were focusing on HIV and AIDS, which people told us that that's something that we needed to pay attention more to in that community, focusing on cardiovascular disease as well as stress management, because the stress that our communities face on average is extremely high. And we know that stress impacts other health issues, whether it's cardiovascular disease, your heart disease, diabetes, all of these things. You have such a stress base that happens there, and even more so now with everything that we see everything that we see regularly within our communities, the things that our communities experience, the stress level it gets even higher, and we need to pay attention to those. So that's what the Access Project was about. Right now, we haven't worked on it as a separate project. Everything is pretty much integrated into our other projects, recognizing that we have within our communities large number of people that were formerly incarcerated. So it's really important to make sure that people are linked to services and people have the care that they need and access to that care.
Absolutely. And I love that there's great intentionality around that specific population of folks who've been incarcerated. It saddens me, and this is the first time that I've heard language like $1 million blocks. And so if it's the first time that I'm hearing it, then obviously I was not familiar with why it's referred to as the $1 million blocks. And so as you so eloquently share with us, it's because those are the dollars that are being spent on prisons within those areas. That is jarring. And as I hear you share those stories, Dr. Marilyn, and I think about the profession of being a barber and the fact that a lot of those individuals have, past time spent being incarcerated, because I didn't realize that was a license that did not require to not have, that as part of your history or your record. But my level of appreciation and value for barbers and hairstylists in general, just because of this conversation, has increased exponentially. Now, I know that I, as a Black woman, because we care about our hair, right? I have so much appreciation for the craft and the trade and just the relationship building. But when I think about how in which those individuals are also such important points of being a conduit of really important information, right? As you mentioned, the word counselor has been used. I've heard people use the word therapist before. And so not to be, certainly traded out for the therapists who've gone through the medical training, but we do get a lot of our information from sitting in those chairs. And so I just wanted to acknowledge the heightened level of appreciation that this conversation is giving me for those. I would be remiss if I didn't acknowledge, because we've mentioned, breast health a couple times, that October is Breast Cancer Awareness Month. And so we usually put that into our rotation as we're sharing some of the different national observances. And you also mentioned the word stress. There's so much to unpack with that word stress. One of the things you and I were talking about before we went live at the top of the hour was that this time of year, we have to pay even more close attention to how stress is impacting our bodies. Because when we consider that people are holding so much, as we get closer to the holidays, people are grieving loved ones. Maybe they're grieving the fact that there's some strained relationships, and, they're thinking it's not going to be the same when we all convene or come together, or maybe we won't, for the holidays. We also have to consider that some people could be displaced from their family members and may not be able to see them. Some people are grieving the fact that it is getting close to the end of the year and I have not met any of my goals that I set out for. And so maybe they're feeling bad about themselves. And so there's a multitude of things. And then you add the social complex issues that we are being exposed to every single day, the mass shootings. I mean, the list goes on and on. We're holding a lot. And certainly it's impacting our mental health. And as you've shared, that stress also can lead to other physical ailments in our bodies. And so I'm curious, what are you sharing with people, particularly as, again, we think about this time of year, for leaning into radical self-care and taking responsibility for our well-being in a way that allows us to show up at our best, even during the times where stress can be really high?
Yeah, Nika, that's such an important thing to talk about, because oftentimes we are caring for others, right? And we feel as though for us to take a pause and to care for ourselves, we sometimes feel guilty to do that. And even having people to have the permission, feel as though they're permitted to take care of themselves, because you have to take care of yourself so that you can show up for others. Because when things are just drained out of you and you're pouring into others and you're empty, you need to be refilled, and you really need to make sure that you are taking time for self-care. For some people, it may be meditation. For some people, going to a therapist and actually talking to somebody about what they're going through. Oftentimes in our communities, we feel that mental health, mental wellness is something that's stigmatized, right? And so for me to go to seek a counselor means that I'm not strong enough. I couldn't deal with it on my own. And so we're trying to change that narrative to tell people it's okay. It's okay to admit that you are stressed. It's okay to admit that we are in a society that is stressful. So unfortunately, it's become so normalized that we deal, as people of color, we deal with stress all the time, and we don't think we're stressed because it's part of our life. And it's like, okay, what, I have to work. I have to take care of our children. I have to do this. I have to do that. And it's just part of my life. And we have normalized it, but it is a time for us to pause, right? There are so many things that people are going through, in addition to, yes, as the seasons change, some people, with it getting darker earlier, people get more depressed, people, the leaves fall off the trees, you get more depressed, you get more anxiety, and you can't wait for the winter to be over, right? Because of the darkness and all of that. And on top of that, you add all the social issues that are going on. As you mentioned, even the shootings that we hear more about now than before, and all of those things that are going on. But telling people to find the time to relax, find the time to retreat, sometimes just having quiet time. One of the things that we have done in the barbershops and the salons, we have created spaces where people can just talk, and we have guided those spaces. We've had a social worker come in. We have done this paint and heal. So people paint, sometimes people use clay to create little things as a superheroes, and we go through those different topics with people. And then on the 30th of this month, we'll have a mental health symposium that talks about non-traditional ways to address mental health, using music, using poetry, using all of these things that we have naturally done as a people, but sometimes we don't, because we don't go back to doing those things, using drumming, beats, whatever, and prayer, and all of these things that as communities of color, we ought automatically have, and for everyone also to utilize those things that we have traditionally used to calm ourselves and go back to a place that is quieter, and a place that we can listen and share, and having conversations with each other. COVID has kind of like put us into these little cocoons and so on, but coming back together, that's important too. And having a social network that you can tap into, those things are important.
Yeah, such great suggestions. I mean, community can certainly play a big role in helping to relieve some stress on us because we know that we are supported, right? And I'm also hearing of a lot of organizations how in which they're leaning into well-being and radical self-care, which is promoting these days off where people can engage in some type of community volunteerism. And, you know, on the surface, you may think, well, you're going to give me a day off to go work somewhere else, but really the notion behind it is when we can decide what we are attaching ourselves to, we usually are going to pick something that's very purposeful for us, right? It's something that we have an affinity to. It's something that fills our cup. And so when I think about community service, that can be very fulfilling when we have the ability to decide where we want to plant our time, talent, and treasures. And so I think that's a great idea. But whatever it is, what I'm hearing you say, Dr. Marilyn, is just be intentional. Sometimes we have to even plan for our self-care, right?
Yes.
Be intentional.
Yes.
I love
we
that.
do have to plan. You know, like one of the things I was reading something, it says spend 10 minutes just being quiet.
Yeah. Right.
Just
Silence.
not listening to
Very
anybody,
great.
just being, it's like sometimes like that's hard. Like when you try to do it for the first time, it's like, oh my goodness, it's so many things race in your mind and you want to talk about something. It's like just stop,
Yeah,
just stop,
exactly.
just stop and
Sit in
pause.
silence.
Yeah.
Absolutely. Something that I have really paid a lot of attention to is I have been much more I guess akin to how radical self-care is so important, right? To showing up for how we want to show up for others and for ourselves. And one of the things that I have really embraced is that radical self-care is a continual process. It involves being intentional, being proactive with our decision to care for ourselves by engaging in different activities that can feed our well-being regularly in a way that allows us to prioritize ourselves and to put self-care needs before we're at a place to where we have nothing else left to give, right? What do they say? Put on your oxygen mask first, feel you can't pour from an empty cup. And so if there's anyone in this community that's feeling that this is, seemingly selfish to like put yourself first and make sure your well-being is where it needs to be, I just want to encourage you that you can't be anything to anybody if you are completely depleted yourself. And so I think we need to also break the stigma that self-care is selfish because it's not. It's actually selfless.
Exactly.
Yeah.
So much so, and even exercising, like going for a walk, going out there, doing, it's so important.
Yep, absolutely. It is. It's very important. So I'm going to be shifting in just a moment to give this audience an opportunity to contribute to our conversation today, Dr. Fraser, and you can do so in a multitude of ways, one of which is if you're part of this Zoom community, you can use the raise hand feature that lets me know that I can call on you. I can add you to the spotlight and invite you to unmute yourself to share directly your question or your comments. If you're just here kind of in an observatory capacity, but you do have some curiosities you wish to follow, you can place those questions into the chat and we will bring that into the discussion. If you're joining us on LinkedIn Live, you can go to the comment section, and my team is really watching that area very closely, and we'll bring your questions and comments over into this space as well. So while you percolate on maybe some of your questions and your comments that you would like to share, I'm going to go to the next question, just give you time to formulate those thoughts. And my next question, I'm still staying on this topic of mental health, and I would love, Dr. Marilyn, for you to share, what do you see as the cultural aspect of mental health? What's the connection point?
Yeah, so dealing apart from the stigma in terms of what we have gone through as people and thinking about not wanting to deal with mental health because we have normalized it. But I think just as a people of color, we've gone through a lot over the years. We have gone through a tremendous amount of trauma that's still there. and then you have things that have built onto that, right? Because we're still facing discrimination. There's still health inequities. There's still inequity. There's still
Yes.
social injustices. So those things have kind of been compounded. And so you have this weathering and this layering effect of different things, right? That we've gone through. So in terms of the cultural piece, or the piece that has just been historic for us, and the historical piece, you have that stresses are being compounded on us, right? And then you have, in terms of the cultural piece, there are different cultural ways that we have dealt with stress over the years and over generations, and even talking to each other, sharing stories, coming together in groups, meeting over food. There are different ways that we have dealt with as laughter, storytelling, and joking, and all these different things. Music has been something that has been tremendous in terms of culturally, right? And different people have utilized those, and so it's important for us to go back to some of those things and make sure that we're okay with it. That, you know, sometimes we deny our culture, deny who we are, and we need to go back to some of those traditional ways to address stress.
I love that. And I think there's also something very soothing and comforting about familiarity, right? And so, you know, really connecting with our roots and our ancestors and our traditions and our culture, I can see how that could be really soothing and calming, in a way to help us to manage our levels of stress. And so, okay, so Michael St. Clair II has raised his hand. So I'm going to add you to the spotlight, Michael. I'm going to invite you to unmute yourself. Welcome. Thanks for joining us today. What is your question or your comment?
Okay, peace to everyone. You kind of answered it, but I want to try to see if you can add a little bit more about tools and resources that people can take home with them. Because oftentimes when people work in the communities, they're fine, but when they go home and have to face themselves, they kind of get complacent. So what kind of tools do you give people to stay positive and encourage them to do things at home when they're by themselves or whatever?
Yeah, so that's thank you so much, Mr. St. Clair, for that question. Because oftentimes, as you said, you know, people hear about things, but what can they do? So even something as this may not be simple for some people, but I'd say exercising is something that's so important when we're talking about stress. Even walking, I tell people, you know, walk 30 minutes a day. Just if it's 15 minutes in one direction, fast pace, 15 minutes the other. Take time to. This may sound corny, but take time to really smell the roses. Take time when you're going through the day to understand things that are happening. One of the things that I've always done and I did before and try to practice, thinking about the things that you're thankful for. Even writing down something at the end of the day, even 5 things that you're really thankful for, and it shifts perspectives a little bit, and you just write those down, the things that you're thankful for. Taking time to breathe in and out, just quiet time. Calling up friends, calling people, talking to people, encouraging others too. You know, Dr. Nika talk about sometimes going out into the community and helping others. Sometimes while you're helping others, so much gets poured back into you, right? And so those are things that you want to pay attention to. For people that may be so stressed that they need to seek someone, they need to reach out to a counselor, reach out into your communities to find out who may be counselors within the different networks that you're working with, and talk to someone. Because those are all things, like sometimes we don't want to do it, but little by little, we're paying attention to it. Even the things that we eat, right? Those things impact our health and impact how we feel. Carbs are good comfort food, but it is not really healthy for you. And it's like, if you have more fruits and vegetables and so on, it helps you to feel better and less sluggish. And so even paying attention to those things, our diet, paying attention to exercise, talking to a counselor, spending time for people that are people of faith, meditating, praying, writing, journaling, sometimes sitting down and writing how you feel, right? Taking those things. So those are some of the tips that I would give people, that are everyday tips that can help you to address like the stresses and so on that we have in our lives.
I love that. Those are some really great examples, Dr. Marilyn. And sometimes what I would also recommend people do is just take a moment to do a self-care assessment. It's not something that we do often. It's not something that we really think about. But I think if we were to just take a moment, a clarity break to think about different aspects, whether it's our physical care, our psychological care, our emotional care, our spiritual care, relationship care, workplace professional care, and then just come up with a list of some practical things that we feel like we can align with that helps us to be much more intentional about the well-being. You gave so many great examples. I will add to it, staying well hydrated. I also think being cognizant of our sleep, right? We need a number of hours of sleep. So how are we making sure that we get that? I love the fact that you mentioned something as simple as noticing our breathing, right? That is so important. And so thank you so much, Michael, for your question. I appreciate you being here. And I hope that those of you who are a part of this community, you're taking note of some of these practical examples that Dr. Marilyn has shared. Okay. So I'm looking at the chat. I don't see any other hands raised at this moment. And so maybe you still are thinking of your questions. What I would like to do now, though, is go to another question that I have for you, Dr. Marilyn. So again, we've talked a lot about the Institute, and I'm so impressed with all that the Institute does. With the vast scope of work being done by the Arthur Ashe Institute, what are the main challenges that you face in ensuring consistent and impactful outreach, and how do you overcome them?
So one of the things as a nonprofit, and for those that are part of nonprofits as well, it's always funding, right? Making sure that you are funded to do the work and to continue the work, because the work is so important to the communities, but oftentimes communities are neglected and resources are not placed where they need to be placed. So funding is definitely an issue. The time our staff is oftentimes overspent because they're doing so much work with very little, and making sure that even within our communities that we're doing self-care, right? That we are taking the time to do what we need to do. So we've instituted mental health days, like, an extra mental health day each quarter, so that you can take time off to just relax and be recharged and not do work, so to speak. One of the other challenges is even getting out there and promoting the work of the Institute, that other people may know about it, because you're doing so much and you may not even be able to write these things and publish them. And when you're going to apply for federal funding from the NIH, the National Institutes of Health, or the CDC, you need to make sure that you have publications. And sometimes that's something that's difficult to do because timing doesn't allow that. But and just making sure that we're disseminating the work on different platforms. And so this opportunity to even talk about our work is something that's important to us. But one of the key things has been funding. And I think with working with others to promote the work, that has been helpful. That's something that we have overcome some of those challenges by really promoting the work and having funding come to us as opposed to seeking
Absolutely. Absolutely. So for those of you in this community, as you've been hearing about the wonderful ways in which the Arthur Ashe Institute is helping to create opportunities to diversify the science field, the medicine field, and to educate the broader community, particularly those who are part of marginalized, underrepresented, I like to say underestimated communities. I would love for you we're going to place the link to the website in the chat. I would love for you to learn more, find ways, and perhaps that you can help contribute to the fundraising efforts of this organization that really is driving impact for so many of us. We only have a few moments left. There's another question that I'm really curious about. As I was reading your bio, I talked about the fact that you've spent a lot of time in medical training, not only in the School of Medicine in St. Lucia, but then also you have practiced in West Indies, Mexico. So when you think about your experience with the Institute, Dr. Marilyn, how, and also given your training in those other areas, how have your diverse experiences shaped your perspective on health disparities, as well as informed your work at the Institute?
Yes. So so one of the things, the training throughout medical school and so on, I've been fortunate. I didn't think of it at that time as being fortunate to be exposed to different ways of treatment, also being exposed to different things in different countries, and how healthcare may be practiced in different countries. And I think one of the things that I've really appreciated in the diversity is that there isn't one thing, like one magic bullet, or there isn't one way of treatment. Sometimes in some countries, people may move more to something that's natural medicine, compared to going for our medicine that are more chemically based medicines. And so you understand also just the difficulties that people have to access care all over the world. You know,
Right.
in terms of like access to care is something that cannot be understated, and something that needs to be promoted in terms of making sure that people get care that's not only equitable care, but also care that is good care and good quality. And so I've appreciated some of those things as I've been in different systems. I've learned more about different cultures, and being appreciative of different cultures. I think with the work that we're doing at the Arthur Ashe Institute, we are in Brooklyn, New York, and you have a host of different cultures and a host of different people, and just trying to understand people. And regardless of where you are in the world, people want to know that you care. They want to know that you hear them, that you see them, and that you do not disrespect them, and you do not disrespect the cultures from which they come. And because the culture may be different from yours, that you do not disrespect that at all, but accept people where they are, and be able to understand their needs, because we all have the same needs, and the core needs and core values that we want people to know about. And so taking the time to understand people, and taking the time to listen to people, and taking the time to give back to people, that's been something that's salient throughout, and I've become more appreciative of that.
Absolutely. It goes back to that gratitude aspect that you mentioned in the conversation earlier. And so when I hear you talk about just that level of knowledge that's important for us to be able to show up very respectfully, we have to build up our cultural intelligence. We have to get out of our bubbles, right? We have to learn about, difference, and we have to make sure that we are being open and helping to practice humility, so that when others do educate us about maybe their cultures, we don't take offense to it, but we take that information as a gift, and we use it to help inform how we may interact with others that are part of that community going forward. So that cultural agility, I think, is so important. In the few moments that we have left, I think about the fact that so many of us may not directly be into this space of medicine, right? We may not be a barber or a hairstylist, but we have friends, we have family, we have our own health issues. And so for those who are sitting back and thinking, how can I make a difference in health within my community if I'm not aligned with some of these other very specific examples that have entered into today's conversations? What advice would you give to individuals or organizations that are looking to make a difference in health within their own communities?
I think, as you said, getting out of our bubbles. That's like a big one, making sure that we step out and listen to our communities. If you would like to know what people need and the things that the community may want, it's for us to go out, step out into the community, go into a barbershop and beauty salon, sit down and talk to folks, go into a community-based organization that may be doing something that you're interested in, volunteering in a community-based organization, doing community events and participating, and really getting out of our comfort zone, so to speak, and taking the time to listen, not going with our preconceived notions and knowledge when we go into the community, but really going in and finding out what the community needs and working with them, partnering with the community to understand the needs of the community, and showing up and being authentic. Because once we're authentic, people will respond. Once we come out there and we're, okay, I would like to help, and how can I help, as opposed to this is what you need. those are two different things. So I'm going with an open mind and going in to learn more about the communities and listening to people.
Yes. Openness, continuous learning. You are giving us some really great practical tips. I also will say that many of us are aligned with different social media platforms. And so as you become educated, use that as a way to share your knowledge with others. And if you're not on social media, then maybe just make sure that part of your conversations with family and friends is one that is providing awareness and education and being an accountability partner around people being very intentional about their well-being. I love the idea of volunteering. You know, when we can volunteer with a lot of different organizations that are focused on creating educational opportunities for people to live healthy lifestyles, that is a great way for us to also play a role in being able to address health within our local communities. And then just modeling, you know, making sure we're staying on top of our own healthcare, right? And we're leaning into, again, that radical self-care that we talked about earlier. This has been a great conversation. Thank you so much for spending this hour with us, Dr. Fraser. We're so grateful. I want to give you the final seconds to close us out in whatever way that feels appropriate. I don't know if you want to plug again the mental health conference that's coming up, or if there's anything else that you have a lot of energy around that you want to socialize as we close out. I want to give you that chance to do so now.
Okay, thank you so much for having me here today. And I just want people to visit our website to find out more about the work of the Arthur Ashe Institute for Urban Health. But I want you to take from this conversation the self-care piece, because Nika, I think that's so important that we take care of ourselves and we show up as our best selves, whether it's taking care of the foods we eat, exercising, just really taking care of ourselves so that we can pour into others. And I just want you to remember that, to take time off, to just reflect. And as we come to the end of the year, each day gives us a new opportunity to do something different. And so we take each day as it comes, and that you can turn the page, so to speak, and have a clean page each day. So I want to just thank you again for the forum, and thank you for all the work, wonderful work, Nika, that you're doing.
Fantastic. Thank you again, Dr. Fraser. Thank you to each of you who have joined this podcast community. If you found this to be helpful, then share it out. Of course, the replay is going to be available this afternoon. We'll extract the audio and make it available in podcast capacity. And so for those who like to get their content in that manner, make sure you don't keep this to yourself. Thank you for joining us, and we hope to see you again next week. Have a great and safe weekend. Bye-bye.
Thank you.